Hi, my name is Gina Murray, RN Director and co-founder of Aware Senior Care in Cary, North Carolina. Today's Tuesday tip from Aware is about hospital or rehab facility discharges. Returning home may bring a range of feelings from excitement to fear, from joy to anxiety. Getting prepared is essential to a successful transition back home for everyone. The discharge planner, sometimes called a case manager, will work with the patient and their family and friends to prepare for the day of discharge. Preparation is especially important if the person returning home has not fully regained all their abilities. It's not uncommon for patients and their families to think that everything will be normal once I get back home. There may be many challenges based on the reason for the hospitalization, and a new normal might need to be established. Throughout the hospital rehab stay, I recommend that the patient, along with family and friends, learn as much as possible about the patient's condition and their abilities. Ask questions of the nurses, the therapists, as well as of the doctors. Was the patient independent at home and now maybe they have to use a walker or a wheelchair? Your case manager will provide you with referrals to agencies for support at home, and this will be based on each patient's needs. The support can come from home health, hospice, palliative care, home care, or a combination of some of them. So my advice, ask for recommendations from other professionals or friends who have used these agencies. Research the agency you're considering. There are many out there. Schedule a time to have the agency representative come to the hospital or rehab facility to explain their services and any costs. Ask the agency how often they visit, how long are the visits, and do they work with other types of agencies. Another part of your discharge plan may include equipment being sent to your home. So my advice is, know who is ordering the equipment. This can be the case manager, the home health, or hospice. It's important to know the name and the contact information for the company. The equipment company is responsible for the delivery and all maintenance of their equipment, as well as the pickup when you no longer need it. The patients need to contact the company if they have issues with the equipment. Know when the delivery is scheduled because you'll need to have someone to be at the house to sign for it. Know what equipment is being delivered, and then make sure everything arrives. You may need to prepare the room, or you need to move furniture to accommodate it. Know that the equipment company will not move private furniture, and hospital beds usually need to be on the first floor for safety reasons. Think about things like available outlets, especially of a hospital bed or an oxygen concentrator. If you are using oxygen, the concentrator must be plugged directly into a socket and not to extension cord. You'll need to think about where are you going to store portable oxygen tanks. These tanks should come with a stand that will keep them upright. If the air is going to be humidified, you'll need to buy distilled water and have that on hand. Don't allow your patient to leave the hospital or rehab facility until all the equipment is in place at your home. Once that equipment's in place, review the list and make sure everything is there and that you know how to use it. If you're not certain about how the equipment works, consider having additional support the first day or days just to help you understand the equipment and to help you adapt to your new routines. Medications may have changed while you've been in the hospital or rehab. You will receive a current list of medications, and that'll be in your discharge instructions. I recommend that you review this list before the day of discharge. See what you have at home, but make sure you're checking that it's a current dose and the right amount. You will receive prescriptions when you're leaving the hospital or rehab. Have them filled before the patient gets home. Not all pharmacies carry all medications, and this is especially important if the medications are for symptom control like pain or anxiety. The 4 slides we just went through are available for download on our Aware website under Resources, Download, and Tools. So think about returning home after hospitalization or rehab stay. Think of the joy and perhaps some of the anxiety. Preparation is key to a successful discharge. Work with your case manager and your support team. Get your home ready, get your team in place, and that'll help you through this transition. Our final tip, a complete discharge plan. Don't go home without it. Thank you and have a great day.